Thank you very much. So I'm Kamil, this is Prasanth, and Shirley, we're going to talk about a product that we developed for one of our clients, in short, BLNK. And it's a product that basically helps them support the diabetes patients, so basically help them provide better care. So so this is the population that we were looking at. So it's a quite a large population of just over 1 million people, which includes about 70,000, just under 70,000 diabetes patients. As you can see, the population is quite diverse in terms of ethnicity, but also in terms of the prevention levels, which creates for a very nice representative population. So nearly a third of those living with diabetes, so you can see those statistics over there. So it's like 1/3 of those living with diabetes come from minority ethnic groups. Ultimately, the population is found as well. So yeah, we've got that variation there. So the whole purpose of the dashboard, it's a dashboard, but it's a product. It's sort of a working system that allows the clinicians, and I think particularly GPs, to be able to identify patients who are not being sort of seen or treated in the right way. So this focuses on 8 main care processes, which are very important to monitor and just essentially carry out for patients with diabetes, some of which are part of NICE guidelines that are meant to be met every 12 months. So some studies in the past have identified the importance of taking some of these measurements. So there's a reason why 3 of those measurements have been included in the NICE guidelines. So one of them is, for example, blood pressure, so taking regular blood pressure checks, or cholesterol checks, or HbA1c protein checks. So these particular tests have been found to be beneficial if taken frequently in terms of reducing mortality in patients. So if you have an involved care where these particular metrics are taken, and this particular study refers to those checks being done every 12 months for 7 consecutive years. If you do that compared to if you do that, it has been shown to improve the patients with diabetes. So that's basically the focus. So in the BLNK population, as you can see, the graph to the left is showing the percentage of people that have had the checks done. So to the sort of left of the graph, you will see that up to about 12% of patients have had less than 3 checks done in the last 12 months. Which means that they fall below that threshold for the NICE guidelines, but also, according to that study, they fall below the threshold for that benefit to be seen. So there's a potential for improving essentially the care for those patients if those checks are done regularly. So that you've got over 47,000 patients, that achieve at least one of those checks. So that's a huge number of people. So the dashboard itself. So the product, it has multiple layers to it. So the first sort of outermost layer is just sort of a systemic overview, which just can sort of tell you sort of a bit more sort of like general BLNK information across the whole population. So you can see the prevalence of people with diabetes. You can see the new diagnoses, the number of new diagnoses in the last 12 months, and a few other things as well. So sort of, for example, whether these particular checks and how are they being done? So for example, what sort of level of compliance can be seen across the whole system, and a few other things as well. Again, sort of seeing the diversity of the population as well as some costs associated with particular activities. And I think we'll get to Tony.
One way to make an practical presentation is to get drenched. It's even better if not really. Hi everyone, I'm Prasanth, Peddaayyavarla, Head of Data Science. I'm representing our in CSU today, representing advanced applications. So this tool that is co-developed with clinicians, designed and the criteria for different definitions. It's not just meant for cost, but it's also meant beyond that, which I'll demonstrate. So one of the views that we have here is the PCN and practice level benchmarking. Let's see if we have this, what's the care process completion of each of the care process, what percentage of the population are not have any care process or the individual care process, and then see where your key factors as well. This is the favorite view for the clinicians. So what we are seeing here is a patient level dashboard live, refreshed every single day. And we've got a significant amount of factors that we squeeze in the dashboard where clinicians can go and then filter out the patients that they're interested in today and then pick up a phone call and then so this tool has been used both by clinicians and GP practice, as well as from community providers specialized in diabetes. So we've got a list of patients here, and then we've got the process here. We've got the queues that was recorded. And you can see that it's not very well recorded at the moment. We're trying to replicate it to this algorithm ourselves. And trying to speak in the community. So we've got standard set of filters that you would see in pretty much any of the dashboards, but we also have, you can find out patients who are not handling their process and then give you that information. That may still not be short enough for one day, because we look at one country here, which is 2005. But we can further filter it, looking at, you can look at a particular age group, for example. One of the use cases of lung is patients who are childbearing age, pregnant or not, to be able to see whether they are their HbA1c levels, if they have diabetes, what their HbA1c levels are, and then take action accordingly. We all know HbA1c should be greater than 58, something that's what I'm not 50%. But it's also the contrary we have to look into as well for some patients. For example, patients with severe frailty, we may want to look at patients who've got less than 48 HbA1c because of the risk of hypoglycemia. So patients like that can be found by just a couple of clicks, and we get the list of patients. One more example I'll go to is the NICE recommends that anybody with a cardiovascular risk or existing cardiovascular disease and diabetes, they should be on the new type of drug called SGLT2R, which will reduce the glucose as well as the cholesterol as well. So that is a nice recommendation. You can find that the patients who have CVD but not on GLT, you can find that as well. Once you get your list of patients, you can do two things. You can re-identify them at that point in time if you have a legal basis, and go about finding those patients further deeper. Or you can click on that patient and go to this view, which is one patient's view. You can see once again a lot of information for clinicians. We want to have one view. It may go against the rules of the BI dashboard. But what we want to do is go and do that information in some short spaces. What's the blood pressure of this patient? Most importantly, what's the fluctuation? There is a fluctuation that may be risk. Similarly for other metrics. We are using a linked data set here. Therefore, we can see by the medications they are on within this part. And then from there, the famous geographs, I believe you all are aware of, where you can juxtapose the information of your clinical factors with the events, adverse events, or things like that, or any medication. You can see where the patient's journey has been. Could we have done something retrospectively for this patient, etc. Information like that. You can see the RAG rate and markers there, that the cholesterol is higher for this patient, there was an A&E to make some kind in the first quarter of 2023 financial year. And yes, what the QDIS was done just a few months before. Could there have been an intervention that we could have taken to make it impactful in the proactive intervention? So that's the dashboard at the fingertips of GPs and nurses at the specialized scale. We also have, as we've seen, we also have the strategic views where you can see what's the total population, where they are missing the targets, which practice we need to focus on. So this is deployed onto our platform called Jemima, or Jemima. So but it's going to be moved to a new platform called Athena. So yeah. So that's the feedback we got from the clinicians as well as the project managers. So it's been a project that is something that I really enjoyed in my whole of dentist career. Data sets available to us, primary, immediately secondary, okay. Then we got the work on the back. They define everything, what they wanted, and that's what there's a lot of But next, we are considering to do something similar for other conditions. We have one that is developed for COPD. We are presenting oral masculine body. So yes, so these are the other presentations from our organization, what we've been doing. But we're also there in CM overnight, right? So that's where we are. These are patients diagnosed with diabetes. Usually patients.
Second question for how old do you think that the performance